This is Phil, and Phil is a pharmacist who is on social media and gives a lot of advice about how to take care of your skin, among other problems.
Instead, I went out and opened my own pharmacy, and it was hard. Trying to run your own pharmacy right now is hard.
Phil is one of the rare pharmacists that does compounding. If you're not familiar with a compounding pharmacist, this is the way that pharmacies always used to be. The pharmacy would get the raw materials and they would mix it up for the patient and then dispense it right there next to the soda fountain in those old school pharmacies.
Get some Meta Honey, fantastic stuff. Then second, you want to get some Camelceptine. You mix the two of them together a couple times a day. It's amazing how fast it'll clear up. It's all amazing.
Now there are a handful of pharmacists across the country who continue to do compounding, and I love my compounding pharmacies. I have a great relationship personally with some of the local compounding pharmacies and the head pharmacists there, and I also use some mail order compounding pharmacies. Now, compounding has become increasingly regulated for a couple of different reasons. It needs to be done in a sterile manner, because when you start mixing things up, if you're not carefully controlling the risk for contaminants and using the right preservatives, then mold and bacteria and things can grow in these formulations. So compounding should be done in a sterile type of environment so that you can minimize to the utmost degree the risk for contamination, because you want the product to work for a long period of time. Now, this is somewhat of a risk when it comes to topical products, but it was a really big risk when it comes to compounded medications that are going inside the body. If you remember a news story a few years ago, there was a compounding pharmacy mixing up a solution that was being injected for patients with back pain. They were injecting it into the area near the spine, and there was a lot of cases of fungal meningitis that led to a number of deaths. And this is one of the things that prompted compounding pharmacy regulations to become even more strict. Now, this is, of course, critically important when those things are going inside the body. Some of the regulations, I think, are a little heavy when it comes to the topical things that we put on our skin, because we're not really at risk of the same types of infections. But nonetheless, compounding pharmacy is an art that we must preserve, because it really helps to reduce the price of certain medications for patients. And you can also come up with formulations that patients would never have access to without the help of a compounding pharmacist. Now, before I start reacting to some of Phil's tips, I do want to say that I have nothing against him personally, and I actually find a lot of his advice to be quite ingenious, and I think it could be very helpful. But there's a few things that I think we need to discuss, and I'm going to give you my opinion on 3 of the tips from videos of his that have done quite popular and even gone viral on TikTok. And if Phil sees this, this is one professional to another, and anybody who works in healthcare knows that sometimes professionals will disagree, and you can do that as adults, and it's okay. This is no personal attack on Phil or his advice. It's just my insights as a dermatologist who deals with skin every day, and what I think you should know to maybe take these tips and put them into practice better, or maybe there's something I think you should not be doing at all. The first video that we're going to react to is that of acne scars. Phil has some tips on how you can treat acne scars, so let's watch that video and I'm going to give you my opinion.
Acne scars. When I was 14, I had so many zits that I was sure I was going to scar. I found this product, and it's like $60, and I thought, can we do better?
That's from Murad.
We totally can. Its main active ingredient, salicylic acid. There's some salicylic acid. This one comes on a lot of silicons. This product, written squalene. I love squalene. And this product that
great.
has retinol 1%. I thought, well, what if we took the salicylic acid idea, the salicylic acid 2%,
Okay.
and we added the retinol 1%.
Mixing them together.
We mixed them together to help reduce acne scars. And I thought, well, you get all the salicylic acid, which will help reduce the redness and help with resurfacing. And then we get the cell turnover rate with the retinol at the 0.5%, and you can put it right where those scars are at. So you get all of the retinol, all the salicylic acid, and you get it for a fraction of the cost. So I'm like, well, yeah, we can do that.
Okay, can you do that? Let's look at the individual ingredients here. That Murad product is pretty expensive, and it's mostly salicylic acid. So salicylic acid is a beta hydroxy acid. It helps to reduce oil on the skin, and it can be an exfoliant that may help with very superficial scars. If you have deep scars from acne lesions, it's not likely to do a whole lot. But a 2% salicylic acid can be a good exfoliator to help turn over those skin cells. You can absolutely use salicylic acid to help minimize the appearance of acne scars, as long as they aren't too deep or too severe. Then he talks about retinol. Retinol is a great way to boost cell turnover and to help the appearance of fresh, healthy skin cells come up to the top. You're thinning out that dead layer of skin cells. And we do often recommend retinol for acne patients as well as those who have superficial acne scarring. And so you can use that. The issue that I have here is that when you take two formulations that are stable in their own bottles and you mix them together, you're introducing the possibility for new chemical reactions that could degrade the products. Retinol is known to be a very finicky product, so when it's exposed to light or it's mixed with other ingredients, it could quickly degrade, and essentially you're not getting any of the benefit of that retinol. Now, it would take a cosmetic chemist to really study this combination from these companies, The Ordinary, to see if they work well together. But my advice is do not mix your retinol and your salicylic acid in the same container, because it's highly likely that it's going to degrade that retinol and you've just wasted your money. So even though you're trying to save money for comparing to the Murad product, you may not be getting any of that retinol benefit. You can use salicylic acid and retinol in the same routine, and my recommendation is to use your salicylic acid in the morning, then put on your sunscreen, and use your retinol at nighttime. You have to pay attention because both of these products have the potential to cause dryness, and you don't want to get too dry or flaky on the skin because that irritation could lead to additional problems. So although in principle I agree with Phil that these products are good and they're much less expensive, and I think it's pretty reasonable for you to buy both of them and use them in your routine if you're trying to fight acne scars, I do not recommend mixing them together and then pouring them in that bottle of squalane, because you're probably going to lose the efficacy, which you just don't need. One other major cosmetic concern that people have in addition to acne scars is bags under the eyes. This is something that I'm prone to as well. If I don't get a lot of sleep, I can definitely see that those bags start to get a little more puffy. Phil has a fix for this. Let's take a look at it and I'll give you my opinion.
Do you want to know where the bags underneath your eyes are coming from? A lot of times it's allergies. So if you get
True.
a real good eye drop like this one here, because this
Pataday.
0.7 oleopatidine's only been over the counter for a little while, and you put that in twice a day, and then you get yourself a nasal steroid, put 2 sprays on each side twice a day. It'll reduce the cause of a lot of the bags underneath your eyes. But if you want to reduce the appearance right away, there's a little trick you can use. So Arnica cream helps reduce the appearance of bruising,
Arnica's not
which
bad.
is what that is. And then Afrin reduces the size of the vessels. So if you take a little bit of Arnica cream and a little bit of Afrin, so it's about 50-50, and put that on twice a day, it helps reduce the appearance of the bags underneath your eyes while you're waiting for the allergy stuff to kick in to get rid of it.
Okay, so he's got 2 fixes, a short-term and a long-term fix for those bags under your eyes. The first one is to address the potential of allergies. Now, if you don't have allergies as the reason for the bags under your eyes, this is not going to be helpful. If you're sleeping 4 hours a night, the allergy medication is not going to fix the bags under your eyes. You do need to make sure that you're sleeping adequately. Pataday is an antihistamine eye drop. It's generally pretty safe, and you can use that to help reduce the active histamine in those eyes, which would leave your eyes feeling bloodshot and just really irritated. So I do think Pataday can be helpful if you have bags under the eyes that are at least in part caused by allergies. Then he recommends a nasal steroid. Again, if you have allergies as the cause of your nasal bags, which you need to find that out, then a nasal steroid could help because it's going to help to decongest, and it's going to help to open up those nasal passages and just kind of inhibit the immune system a little bit so that you don't have so much swelling and congestion in your sinuses. And when your lymph nodes and your lymph fluid is able to flow a little bit better out of that area under the eyes, you should see a reduction in those bags under your eyes. I do think that if you have allergies and you want to use these things, I'm okay with that. The long-term use of steroids in a nasal spray is still pretty darn safe, but I would recommend that you take a daily antihistamine medication as well, like Zyrtec, Allegra, or Claritin, because those have been shown to also be quite helpful in reducing the symptoms of allergies. And those antihistamines are not sedating, so there's very few side effects from them. Again, if you're going to start a new medicine, even if it's over the counter, it's a good idea to talk to your doctor about that to make sure that it doesn't interact with anything else that you take. Next, we get into the topical treatment of the bags under your eyes. Now, there's a ton of eye serums and eye creams that you can go out and buy, and some of them get pretty darn expensive. So what do I think about this combination of Arnica cream and Afrin nasal spray? While arnica is generally pretty harmless, you do want to look for a formulation that doesn't have fragrance in it if you're going to be using that under the eyes, because that eyelid skin is pretty thin. If you have bags, especially if they're caused by allergies, your immune system is already ramped up and you're more likely to get irritated by that fragrance. So I don't have a problem with that recommendation of arnica if you want to use that as an eye cream and it's not causing you any problems. Then he talks about adding a couple drops of this Afrin nasal spray. Now this is where you could run into some problems. Afrin nasal spray does help to constrict the blood vessels. When you use that in your nose like it's intended, you can instantly breathe better, and that lasts for 6 to 8 hours. It's an amazing feeling. But the biggest risk for Afrin nasal spray and drugs in this category is the rebound phenomenon. If you've ever used Afrin, you feel great for about 6 to 8 hours, and then when it wears off, it's almost like the door just gets shut in your nasal passages, and you can be so congested again right away. So then you run back to the Afrin and you use it again, and you can get essentially addicted to this. And if you use it daily for years, there's actually reports of people having strokes, ischemic strokes, due to that constant blood vessel constriction, because it doesn't just affect the nasal passages. Some of that medicine gets carried into the deeper blood vessels of the brain. So that's why you do have to be very cautious about using Afrin nasal spray every day. Now, what about using it on the skin? You are probably going to see some constriction of those blood vessels, which could help to immediately depuff the bags under your eyes. I wouldn't recommend this as a daily solution because that Afrin nasal spray is formulated to be non-irritating when it goes in the nose, but not necessarily when it's used on the skin. So this does carry the potential to be more irritating just because of the way that it's formulated. There are prescription treatments that have similar medications to Afrin nasal spray. Brimonidine and oxymetazoline can come in topical creams as Mirvaso and Rofade, and we use these in patients with rosacea who have a ton of redness on their cheeks. And it does help to depuff and to take away redness. But just like Afrin nasal spray, using it topically in an approved formulation has a huge risk of a rebound. And so when you use Afrin nasal spray and you put it under the bags of your eyes, it's probably going to work for a few hours. You have the potential to become irritated or addicted to it, and you should expect some rebound phenomenon. I like to call these creams, oxymetazoline and brimonidine, the Cinderella creams, because if you're going to use them and you're going out for a date night or you're going to a wedding, you better be home by midnight or you're going to turn into a pumpkin, or at least a tomato. So overall, I think most of this is spot on for helping to reduce the appearance of under eye bags, but I personally would not recommend to my patients to use Afrin nasal spray on the skin. Now here's the third and final video that we're going to react to today, and I was tagged in this one a whole bunch online, and I did make a TikTok video about it. Let's watch his tips for reducing the risk of sunburn, and I'm going to give you my opinion.
Ibuprofen reduces sunburns. You take it before you go get out in the sun. Then the PGE2 in your skin is blocked. Still wear your sunblock, but if you can block PGE2, you don't get that red irritated skin afterwards. Plus, it reduces the damage to the DNA.
Okay, this is controversial. I don't recommend this at all. I'm just going to get that right out of the way. Ibuprofen and other non-steroidal anti-inflammatory medications, or NSAIDs, non-steroidal anti-inflammatory drugs, they help to reduce prostaglandin levels in the cells. And these prostaglandin levels, they are increased. They're sent out as a signal to help promote swelling, redness, pain. These are all signals for our body to know, I am injured. We need to fix this problem. And so when you take these medicines, they reduce those prostaglandins, that PGE, and you feel better. You have less pain because that signal is not being sent to your brain. So if you take ibuprofen before you go out for sun exposure, you are going to see a reduction in those prostaglandin levels. Now, if you didn't apply enough sunblock or you forgot to reapply, you can start to get burned, and your brain may not feel that signal in time, and you'll actually end up with a worse burn than you might have otherwise gotten, because earlier you might have felt that heat or that discomfort that could have triggered you to reapply your sunblock or to get into the shade. He also cites that taking the ibuprofen can reduce damage to the DNA, and I would love to see the literature on that because I've never been familiar with that kind of claim. I'm not aware of anything that says taking ibuprofen reduces DNA damage from ultraviolet light. And so my assumption here is that you will still get just as much UV damage to your cells, the potential for mutations that lead to skin cancer, And you might even get more because you're not necessarily going to feel that, and you'll put yourself at greater risk. Additionally, there's a small percentage of people that can get a phototoxic reaction from taking NSAIDs. Remember that metabolites of these drugs are dispersed all throughout your body, and some of them will get into your skin. That's why you get some of the effect of reducing that redness and swelling. But in some individuals, that combination of UV light plus the drug metabolites in the skin can actually cause a photochemical reaction that could lead to a really bad burn. I do appreciate that Phil recommends wearing your sunblock. Make sure that you're putting on enough before you go out, and always reapply every 2 hours while you're out in the sun, or every 40 or 80 minutes with a water-resistant sunscreen if you're sweating or swimming. The last point that I want to make about taking ibuprofen frequently is that ibuprofen can be really hard on your kidneys. If you have any level of kidney impairment and you're taking ibuprofen daily, any nephrologist will tell you that's a really bad idea. Now also, when you're going to be outside in the sun for several hours, what activities go along with that? A lot of times people are going to be drinking alcohol. They're probably not drinking enough water and potentially getting dehydrated. And then if you're taking ibuprofen and your kidneys are not getting enough fluids through them because you're dehydrated, the ibuprofen can concentrate in the tubules of the kidney and actually lead to acute kidney injury that could cause your urine to turn brown because of those dying kidney cells, and you could be looking at a hospitalization. So I do recommend being so careful with taking ibuprofen before intense sun exposure, especially where you might get dehydrated. I don't think that ibuprofen is a good prophylactic against sunburn. Wear sun protective clothing, wear wide-brimmed hats, wear UV protective sunglasses, and make sure to apply an SPF 30 or higher sunblock to any exposed skin and reapply every 2 hours. As I wrap up the video, I want to say that I really do appreciate the knowledge that Phil puts out, and I do learn a lot from his videos. I just think that there's a little bit of nuance that I'd like to clarify on some of these tips, because the experience that he has as a pharmacist in counseling with patients is definitely different than the experience that I have in the way that I counsel with my patients. Because pharmacists, they dispense drugs, they give a lot of counseling, a lot of advice, but we see different things when we're seeing patients in the clinic, and it does take a team effort of doctors, nurses, pharmacists, nurse practitioners, and physician assistants to work together to help to promote the health of the patient. So I mean no ill will by some of the disagreements that I have with Phil, but I think that they take some nuance, and I want people to learn what I do and don't agree with. If you guys like this kind of video, let me know down in the comments, and I can do some more reactions to Phil or to other health advice online. I hope that this was helpful, and again, I want to give my best to Phil. If you happen to see this, thank you for putting out good information on your platform, and sorry that we disagree sometimes. I hope everybody has a good day, and stick around and watch this next video to learn more how to stay healthy.